So once we have a research idea, and we have established that there is clinical equipoise, there is uncertainty about that research question or the research idea that you have. The next thing is to start working on your research question. So before talking about the research question, I'll briefly talk to you about research hypothesis, because research hypothesis is an important component, and it is important to have that at the start of your research. And in fact, research hypothesis and research question, when you are actually conducting the research, those goes together. You are developing your research question, at the same time you are thinking about the research hypothesis. Or when you are thinking about the research hypothesis, you are also refining your research question. There are three different types of research hypothesis. One is superiority, other is non-inferiority, the third is equivalence. Superiority indicates that treatment A is better than B. So when we have, for example, if I say that a new medication to treat hypertension is better than the standard care, that is my superiority trial. Okay? But how we define better, that is an important question that you have to think at the start of the study. Whether that better means how much percent increase in the patients who were treated with the new medication. Whether there is an improvement, how much percent, whether 5% is clinically relevant or 10% improvement. For example, if treating your patients, all of your hypertensive patients with beta blockers would be beneficial for 30% of your patients. Would new medication would be beneficial for 40%? So in that way, we are looking at a difference of 10%. Then is the non-inferiority, where treatment A is not worse than B. Okay? So see the difference? Treatment is for superiority, treatment under investigation should be better. For non-inferiority, it should not be worse than B. Okay? So we have to develop a range. That what is the range? It can be the treatment, new treatment will treat 25% to 40% of the patients. You provide a range as compared to the standard care where the treatment effectiveness was 30%. Okay? So you have a margin. And equivalence is treatment A is neither worse nor better than B. There are the issues that we have to keep in mind for the non-inferiority. Because if there is clinical equipoise, we have to, what is already known, if the standard care or the previously known treatment is effective, then we have to be careful in designing a hypothesis that is non-inferiority. So I talked to you about research idea. So now we'll talk specifically about research question. What's the difference between research idea and research question? Research idea may be thinking about the same example that we have, whether the new treatment is more effective in treating hypertension. That is a research idea. That is not a research question, because research question requires certain elements. It has to have certain elements to be a research question. Okay? We'll talk about those in a moment. So the types of clinical research, we can have different types of clinical research questions. Those can be focused on therapy, whether medication is more effective, one treatment is effective than other. Harm, whether the adverse effects associated with one medication is lower as compared to the standard medication. Prognosis, what is the survival among patients suffering from certain conditions, suffering from cancer, whether your intervention would improve prognosis. Screening, the effect of screening and the different comparison of different types of screening tests. Those can be diagnostic studies where you study the different types of diagnostic tests. All of these are examples of quantitative questions where you measure those outcomes in terms of numbers. But that doesn't mean that clinical research cannot be qualitative. You can have a qualitative question also that you can answer with the help of clinical data or with the help of clinical research.